and welcome to today's session on Sushruta Samhita Adhyayana. Without any delay, I would like to call upon Dr. Mulidhar Sharma sir, Professor Emeritus, STMCOD, to take over the session. Welcome to you, sir.
अथा तो मूत्रकृच्छ प्रतिषेधम अध्यायम आख्यास्यामः यथोवाच भगवान् धन्वन्तरिः. After the mutraghata, the mutrakrichra is the chapter. Mutrakrichra, the word meaning would be where there would be a difficulty in micturition. Rather, it's related to the situation where the patient would have a pain or burning sensation, or maybe at times it could be even the content of the urine could be altered, which can produce the difficulties, pain as such. The type of these mutrakrichra are vatena, pittena, kapena sarvaihi तथा अभिघातैः शकृत अश्मरीभ्यां तथा अपरः शर्करया सुकष्टो मूत्रोपघातः कथितो अष्टमस्तु. The 8 varieties of mutra upagata or mutrakrichra are mentioned, and they are vataja, pittaja, kapaja, tridoshaja, abhigataja, that's due to the trauma, and shakrit ashmari, due to either the fecal material or the stones which are present in the bladder. And then shakaraya, the crystalluria, also is one of the type of the condition which produces the difficulty in micturition. Alpam alpam samutvedya mushka mehana bastribhi phalabhi iva krishena vata ghatena mehati. Due to vataja mutra krishna, patient would be passing small quantities of the urine every time with a lot of discomfort, and there could be severe pain in the genital area, in the scrotum and the penis, etc. Then in case of pittaja variety, haridram ushnam raktam va mushka mehana vastribhi agnina dashyamanaabhihi pitta ghatena mehati. Due to pitta, the mutrakrichra patient will be presenting either yellowish colored urine or burning this blood colored condition, or even occasional blood also, and burning sensation in the genital area would be seen. Snigdham shuklam anushnam cha mushka mehana vastribhi samhastaroma gurubihi shleshma ghatena mehati. In case of shleshma ghata or kapaja mutrakrichra, the urine will be whitish in color, pale color, and it will be relatively cold, and the patient would have some hair raising sensation or pricking type of maybe irritation in the genital area, not pain in the kapaja variety. Dahashita rujavishtaha danavarnam muhurmuhu tapyamanastu krichena sannipatena mehati. Due to sannipataja condition, the patient would be having all the clinical symptoms like burning sensation, at times cold, or so on. In the present day situation, of course, we do consider these conditions in case of urinary tract infections, and the clinical symptoms do definitely vary. You can see these patients with these variation clinical symptoms, which are not really made out like why the difference. Occasionally the symptoms may vary depending upon the type of the organism which is involved, but still it may not be exactly the same. Anyway, clinically you can make out exactly these differences in the clinical symptoms, variation in the clinical symptoms, but they are not given due clinical importance in the current science, whereas from Ayurvedic point of view, these Vata Pitta Kapaja approaches would be the major guideline for the management as such. Now, the other varieties of mutrakrichra are shalyena kshateshu abhyateshu cha mutravahishu shalyena kshateshu abhyateshu cha srotasya mutraghasthu jayate bhrishvedanaha vatabastresu tulyani tasya lingani lakshayet shakrat pratighata vayuhu vigunatam gatah admanam cha sashulam cha mutrasangam karotihi. If there are any solid particles in the urinary tract, then that produces a difficulty in micturition, and characteristically these symptoms are suggestive of or the similar to that of vatabasti. Now, whenever there is any solid particle in the urinary tract, the patient would have a colicky pain, that due to the movings of there would be colicky pain. At the same time, it also produces an obstruction, so there can be a proximal dilatation along with the infective symptoms, and that's the importance of the either a foreign body in the urinary tract or due to the injury. These could be the clinical symptoms, though either it could be due to the obstruction within the lumen of the urinary tract, or A urinary tract obstruction can also occur due to a pressure effect from exterior, and the pressure effect could be Shakradastu Pratighata due to constipation, loaded stools. Of course, it's not only the loaded stools, any other pelvic mass, even uterine mass also can produce the same, or any other pelvic mass lesion can produce an obstruction to the urinary tract, and the similar clinical symptoms could occur. The only difference is when the pressure is from the exterior, there may not be a colicky pain. Instead, the dilatation effect could be seen. So, ardhanam cha sashulam cha, there could be ardhana, the distension of the urinary tract as well as maybe the abdomen, and the pain also would be presented. Ashmari hetaka purva mutragatah udaharah. Ashmari is described in the previous chapter. In the present day situation, when the patients present with urinary tract infections, one group of diseases called urinary tract infections, the clinical presentation would be varying as well as the etiological factors would be varying in these different categories of the patients. And for the sake of practical convenience, in the clinical practice, we categorize the patients into pediatric, females, males, and the post-intervention. That males in the sense males, adult males as such. The clinical symptoms can be varying in the urinary tract symptoms at different sorts of the presentations. In very young or pediatric, early pediatric practice, 0 to 6 months, having urinary tract infections, the most common clinical symptom will be failure to thrive. The child would not be able to make the milestones of the development, and then the other clinical symptoms could be fever, jaundice, overfeeding, vomiting, irritability. So most of the times in a pediatric condition, the clinical diagnosis of urinary tract infection becomes difficult only when we go into the investigations of a child who is not able to pick up the growth milestones. One of the all such children where the children would not be able to make up these milestones of development, one of the investigations which we do is a urine examination, and the identification of an organism is often possible, and in such conditions the treatment has to be varied. Whereas in case of children between 6 months to 2 years, the late pediatric conditions, the clinical symptoms will be poor feeding, fever, vomiting, urine smell also could be presented, strong smelling urine, abdominal pain and irritability. That strong smell of the urine is the most common clinical symptoms. Children aged between 2 to 6 years, the common clinical symptoms are enuresis, the most important, of course. This has to be underlined. Enuresis, that where the child would have this absence of control, loss of control over the maturation, and then the smelling of the urine, strong smelling of the urine, or there could be the other urinary symptoms like dysuria, urgency, frequency also can occur. Abdominal pain, fever and vomiting could be the other clinical symptoms. Children older than 6 years, the late of that pediatric practice, the common clinical symptoms will be pain, vomiting and abdominal pain, or maybe the pain in the back or flanks. Urinary symptoms also common occur. Enuresis or incontinence also can occur. Fever would be the common clinical symptom in all such conditions. So these variations in the clinical symptoms now are attributed to the differences in the age and the response of the body, whereas these differences are exactly what we see in the dosha lakshanas, vataja pittaja kaphaja lakshanas, are they exactly the same issues. The other clinical signs which you may see in any age group of the pediatric practice would be either there could be tenderness in the costovertebral angle, or there could be abdominal tenderness on palpation, or there could be suprapubic tenderness on palpation, or there could be a palpable bladder, there could be dribbling or poor stream of urine as such. The conditions or causes for the urinary infections now are categorized into factors which increase the urinary stasis, like the stones, tumors, urinary tract, exactly Ashmariya Abhigata, or the extensive obstruction like tumors, fibrosis, etc., or urinary retention due to neurogenic bladder, where the bladder wall is not able to expel out all the urine as such. There could be a renal pathology, structural renal pathology, like congenital pathologies like horseshoe kidney or so on. Such conditions could be one set of the causes for urinary infections, which can result in urinary stasis, where the urine is not excreted completely or stagnation occurs. That could be one of the causes. The other causes of urinary infections now are maybe the foreign bodies like urinary tract calculi, catheters, or instrumentation like cystoscopy, urodynamic study, etc. Wherever we do handle the urinary tract as such, there is a possibility of infection getting in, and then the symptoms may persist. Anatomical factors like congenital defects of the urinary conditions or fistula, there could be some abnormal connection between the other organs like vagina or maybe the intestines with the urinary tract, which again is a congenital variation, or it can also occur as an acquired complication of maybe surgical intervention or certain of the diseases. Then in females, the female urethra being shorter, there is a possibility of the frequent infections, and vagina being the most frequent source as such. Obesity also is one of the factors. The other factors which increase the chances of urinary infections are conditions which affect the immune responses like aging, diabetes mellitus, or HIV, etc. The patients who have functional disorders like constipation or voiding dysfunction, I would consider this as the Vega Varodha, where the patients would not pass the urine properly, or other factors which increase these are pregnancy, abnormal estrogenic factor, and then sexual activity, particularly with the multiple sexual partners, or personal hygiene also could be the other causes. There is one more condition called as community acquired UTI, which is defined now. It's one of the very important issue now, where the urinary tract occurs in the community within less than 48 hours of hospital admission and was not incubating at the time of the hospital, and is the second commonest diagnosed infection in the community. So when the person goes to a hospital or where there is a environment where there could be infections as such, particularly in the hospitalized patients, when catheterization is done, this is one of the most frequent issues, or any indirect or direct handling of the urinary tract can be one of the causes. And as per the data, the global burden of UTI is about 150 million people, one of the frequent issues. And one of the serious concern in patients of urinary tract infection is the resistance to the antibiotics. The reasons could be many, and whenever in the contemporary science, if you look at the urinary tract infection pathology, the most serious concern would be the organisms and resistance of the organism. In India, the resistance of the organism to different antibiotics is increasing very rapidly, and this is based upon the data. In 2018, many of these were sensitive. By 2013, many of these antibiotics have become resistant. But of course, we do not have a corresponding data of 2024, and if you have a similar data, definitely yes, most of these are antibiotics would be resistant, and that is one of the major concern now in the contemporary medicine. And this is where we definitely, Ayurvedic treatment can definitely make the better outcome. Anyway, that's one part. We will continue the other part now. The other part is the Sharkara, the crystal area. Sharkara or crystals now are considered as the precursors for the stone formation. But according to Sushruta, the Sharkara or crystals are the consequences, sequelae of a stone formation. A stone getting broken down due to the other activities, the stone crystal area would occur. Anyway, that's one of the differences in the approach now. It's also a matter of debate. Maybe both the aspects are true. It's not that one aspect is absolutely true and the other is wrong, but both of them have some their utility. But practically, from the most practical clinical point of view in the contemporary situation, presence of the crystals in the urine are considered as a precursors for the stone formation. Anyway, the clinical symptoms are अश्मरी शर्करा चैव तुल्यसम्भवलक्षणैः शर्करायाः विशेषं तु शृणु कीर्तयतो मे पच्यमानस्य पित्तेन भिद्यमानस्य वायुना श्लेष्मणो अवयवाः भिन्नाः शर्करा इति संज्ञिताः हृत्पेडा वेपतु शूलं कुक्षौ वह्निः सुदुर्बलः ताभिर्भवति मूर्छा च मूत्राघातश्च दारुणः मूत्रवेगनिरस्तासु तासु शाम्यति वेदना यावदन्या पुनर्नेति गुडिका स्रोतसो मुखं शर्करा सम्भवस्येतद् मूत्राघातस्य लक्षणम्. According to Sushila, as I told you, the stones are consequences or sequelae of the crystals are the sequelae of the stones, and which can occur due to the either effect of vata or pitta or kapha when the particles are separated, and these particles flow through the urinary tract. There would be acute pain, and even the pain could be so severe that the patient may have unconsciousness. And once that stone passes through or crystals pass out as such, the patient would have a relief. And most of the times there would be a spontaneous expulsion. This part is absolutely true. Whenever there is a small stone passing through, usually less than 5 mm, there would be acute colicky pain, and once the stone is expelled out, the patient would be symptom free. There is a possibility of a recurrence of the stones, and hence the urinary examination, microscopic examination of the urine is usually done, and the common types of the stones, crystals which are identified are either oxalate crystals or phosphate crystals or cholesterol crystals, cystine crystals, sluvite or uric acid crystals. The microscopic appearance of these crystals are very classical, and they can be easily identified under the microscope. And these are the microscopic appearances. Oxalate crystals are usually prismatic shape, and phosphate crystals are stick-like, and cysteines are hexagonal in shape, sluvite are rectangular, and these shapes and colors appearances are very characteristic in case of microscopic examination. And in the present approach, the treatment plan can be according to these etiological causes. The metabolic factors which increase these can be managed. Now, from Ayurvedic Sushruta's point of view, the treatment protocol would be Chikitsitam atha etesham ashtanam api ukshate. The treatment protocol of all the 8 categories are described as Ashmarinja Samashrite Eduktam Prasamikshara Yathadosham Prinjita Snehadim Apijakramam. Ashmari Chikitsa is mentioned in the Chikitsa Sthana, and the same protocol has to be followed. The other drug regimes which could be used are Shradamshra Ashtam Vidho Kumbhim Hapusham Kantakarikam Balam Shatavarim Rasnam Varunam Girikarnikam Tata Vidarigandhati Samsatya Tarvitam Pacheta Tailam Bhusam Vata Payam Tena Vapi Anuasanam Pratyattaravastrinja Vata Kritshopashante. In the Vataja mutrakrichra, either Taila or the Ghata prepared with the Shradamshra Ashmamita etc. Have to be given either orally or in the form of Vanvasana or Uttaravasti. Shradamshra Surase Tailam Sagudakshira Nagaram Pakpa Tat Purvadyojam Tatra Anila Rujapaham. Another yoga for Vataja Mutrakricha. Mainly Shradamshra or Bhokshara is one of the most frequent used drug there. Truna Utpaladi Kakoli Nagrodhadi Gane Kritam Pitam Grisam Pitakritram Nashayeta Kshiram Evava. Trunotpaladi Trunapanjamula Dravya or Kakuli Nagrodha etc. Or these have to be prepared in the form of Grita, which is used in Pitta variety. Bedya Uttarabasti in the Pitta Krishopashante, the same also can be given in the form of Uttarabasti. Yebilev Kritasneha Trividheshwabi Bastishu, Hitam Virechanam takes Shira Draksha Raseridam. The same drugs also can be used in all the variety of bastri, that's Anuvasana, Niruha, or Uttarabastri, or Virechana with the Ikshukshira also can be done. Surasa Ushakam Stado Varunado Chayat Kritam Tailam Tata Yavagwadi Kapaghate Prashasti. In Kapaja variety of Mutrakricha, Surasadigana, Ushakadigana, or Musadigana, or Varunadigana Dravyas are used in the form of Yavagu or acid. Yatha Doshatrayam Kuriya Deta Nemata Sarvajay Falgu, Vrishchira, Darbha, Ashmasara, Churnamva Varina, Churnancha Varina, Sura, Ikshurasa, Darbha, Ambupitam, Krichravapaham. In other conditions, depending upon doshas, you may select any of the drugs as such, or you can give water which is processed with the Falgu, Vrishchira, Darbha, Ashmasara. That's a different plant substances are added. तथा अभिघातजे कुर्यात् सद्यवर्णचिकित्सितं मूत्रकृत्ये शकृज्जाते कार्यावाधारिक्रिया स्वेद अवगाह अभ्यङ्गबस्तिचूर्णक्रियास्तथा. In the traumatic injury condition, Sadhyavarna treatment principles have to be followed, and Shakrat-jata, that's due to the fecal impaction, if there is a urinary abnormality, urinary symptoms, that has to be managed with the Vata Shamaka Chikitsa, like Sweda, Avagaha, Abhyanga, Basti, Churna, etc. Yet Vanyetu Mutrakritya Tayoh Prokta Kriyavihi. The similar protocols can be used in any other mutrakrichra as such. With this, we will conclude this chapter. Sushruta Mutrakrichra Mutrakrichra Pratishedo Nama Ekavimshatitamo Adhyayah Aditah Ekonashashtamo Adhyayah. So we will conclude today. If there are any questions, we will try to answer. Right? There are no questions as such, so we will wind up. We will continue in the next session.